Have you ever wondered what those two little circles are that are on your x-ray when you go see the foot doctor? That's what we're going to look at today in this episode of Healthy Living. Welcome, and what we're going to go over today is this question that I get every single day when I get x-rays in the office. Basically, patients, they might have a foot problem somewhere else, but it happens to be, they always ask, hey doctor, what are those two little round dots that are underneath my big toe joint? That's what everyone is wondering. We're going to go over that today. These little things right here, these are called sesamoid bones. And what exactly are a sesamoid? Well, if you look at it, these little sesamoids right here, there's two of them, and there is a tendon right here that goes between them called the flexor tendon. Basically, the flexor tendon is the one that pulls down the big toe joint. Why in the world we always use our hands to explain things? Probably because it's easier to use my hand than it is to take my shoes off and show you my feet. But this sesamoid, they actually have this tendon that run on in between here, and it uses it to stabilize and kind of plant your big toe on the ground so it doesn't lift up. That's what it does, but there can be certain problems. Now, we do have other sesamoids in the body. The most common one, guess where it is? It's the patella, or your kneecap. The kneecap also is a sesamoid bone that is connected to the muscle and connected to your lower leg, and it kind of goes back and forth and glides. So that's another example of a sesamoid bone. Specifically, there's a couple of problems that can happen with the sesamoid bones. There's two of them, right? One is on the inside, one's on the outside. And as someone develops a bunion, these kind of drift into the inside. And if you can imagine, since the tendon is being pulled this way, it can cause the toe to drift even more. That can happen, but the bigger issue is they can have little splits in them. So these splits can be caused from trauma or injury, which would be like a sesamoid fracture. It also can be caused because someone just has two pieces of a bone there. That's very common. That's called a bipartite, or a two-pieced sesamoid bone. Sometimes they're painful, sometimes they're not. Usually if they're a two-part bone, they have a nice even line between them, like you can see here. This is a nice even line here. If it's a fracture, it tends to be more jagged. But these two pieces of bone are usually held together by some type of fibrous tissue. And even though it is a two-part bone, that area could kind of break apart if you do a certain type of an injury, specifically if you hyperextend. So if your foot or your toe hyperextends all the way back, that can be an issue. Once again, you can see how the muscle belly right here, that inserts and then around this area, and then there's that tendon that runs right between there, okay? And it can either be a tendinitis, which is an inflammation, or it can be a fracture of that bone. What is kind of the difference? Well, the main difference is that if you have a bipartite or a two-part bone, it usually isn't a problem. A lot of times we get x-rays and we can see these two-part bones and they're not really an issue and no one has pain. But if you get one and you're unsure, a better way to look at it is with an MRI. Basically, in an MRI, you're going to see these the two dots should be here, and only this one is all white, and that would mean that that one's most likely fractured or injured to that area. Once again, you can see here, this is that tendon right here that I mentioned that glides between these, and as the toe bends, these kind of glide back and forth. They can also develop arthritis in them as well. Once again, the best diagnostic exam is probably going to be an MRI. An ultrasound might be okay, but in an MRI, you're going to see more uptake. You can see this whiteness right around here, and in this fracture, this is one that, see, it's not an even line. It's kind of a jagged line right here. So that would be an example of an x-ray. How do you treat this? Well, I like to kind of divide treatments into most and least effective. The most effective treatment, if it is an inflammation, would be cortisone injection, oral steroid or non-steroidal icing, things like that. If it is a tendinitis, once again, you need to go see a doctor to figure out if it's that or if it's a fracture. If it's a fracture, you can try a cortisone, but cortisone can sometimes slow healing of a fracture. And the problem is with the sesamoid, it's pretty much all covered with cartilage, and it doesn't have much blood supply. That's where we use shockwave treatment for those to kind of injure it, to help it to heal, help it to get better blood flow. Occasionally, we'll do physical therapy, not too much. It doesn't usually heal a sesamoiditis or a sesamoid fracture, but if there's difficulty with range of motion, that can be helpful. Orthotics can sometimes be helpful to offload the area, as well as a walking boot. Those can all be helpful. And also a sandal that has a really good arch support and a lot of cushion that can be helpful in an appropriate shoe. So all these things can kind of be helpful for patients. I tend to work on the things that are further up here on the top of the list. Once again, I hope you guys found this helpful. I'll put another link to some other videos after this, so you can learn more about sesamoids, some of the other videos that we have. Okay, thanks guys. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.